And your state representatives and senators.
Essentially, the lowest group of people who have been paying their own bills. And, I mean, I'm like you, I've got the Anthem, you know, mine's 12,000. But, you know, it's pretty sad. I paid out of pocket for a cornea transplant. Because I went, it took me 4 years to save the money to do it. 4 years to save the money for a transplant.
But aren't there still options
There was
for
none.
people to still qualify for catastrophic in certain cases?
You gotta pay for your own, I'm paying for catastrophic insurance.
I understand.
Yeah, no,
but
not in the state of Maine.
With the ACA?
No.
Not. I know under 30, but I thought they were also.
Yes, there is a hardship waiver so that people of any age can qualify for the catastrophic plan. Important to point out that that $6,350, the $6,350 out-of-pocket maximum applies to the catastrophic as well. So do all of the 100% payment on all the preventive services. That's true for any plan. Also applies to the catastrophic, and the first 3 medical visits are covered under catastrophic. So it's a richer catastrophic plan, so it's not going to be as cheap premium-wise as what we've been seeing in years past.
So in other words, if we're paying $380 some odd now for a catastrophic plan, there's a possibility that it's gonna cost us even more to be covered, which legally we need to have coverage.
But there's at a certain income level, there's also an exemption to the individual mandate, so you wouldn't face.
Yeah, but then even with the exemption,
Right.
you still are responsible if you have.
If I can answer that
Right.
one, York would definitely accept people
Oh,
with Anthem.
right, so the
But
point is
for
we
the
want to
narrow
make sure
network,
people
that
get
new
access to
plan on the
coverage.
marketplace,
But it is
coverage
true
not
that
accepted. You still
catastrophic
come here for
coverage
care,
in
but you'd be paying
2014
out of pocket or
will be
be working with our free
more
care
expensive
program.
because there's
We would
more
never turn
benefit
anyone away. So you still
associated with
come
those
here.
plans.
Anybody with a
And
grandfather
and it
plan
is
or
this
Medigap plan or
catch-22
Federal Blue Cross and Blue
with
Shield
regard
or
to
Anthem plan. Those are
premium
the
pricing,
That
but in
was
terms of the
actually my
true
question.
benefit
I've never used
that
the service.
somebody will get out of the plan,
New York State.
there's a lot more to it than what we've seen in terms of the hollowing out of benefits over the last few years.
Another question. So,
We have
Kevin, can you repeat that question?
Yes, so the question is, what happens if you go to Florida or any other state in the country, or it could be Puerto Rico as well. We have a national network of providers, so rest assured that you can get access to an in-network provider.
Copay, deductible, and coinsurance. Could you describe or define those terms?
Sure. So here we talk about deductibles. So for a gold level plan, or I'll pick silver, middle of the road, the deductible is $2,000. So for those services, and I should point to the copay first. Okay, copay of $30. So for an office visit, primary care office visit, or a behavioral health office visit, because it's parity, it'd be $30. That's if it's not related to the chronic illness support program we talked about. For prescription drug coverage, not on here, you have 4 different tiers of drugs, much like as you do today. Those would be copay for generic drugs, and then we'll talk about coinsurance in just a minute. Then deductible for anything that doesn't have a hard value copay. We're talking about a deductible. You pay up to that deductible of $2,000. Beyond the deductible, then you're paying a responsibility of 30% for bills above that. All of these out-of-pocket expenses accumulate and are accrued to the maximum out-of-pocket costs, in this case of $6,350. So once you hit $6,350 in the course of a year, if you're having that much utilization, then it's all on the plan. So it's Co-pays are the hard values. You pay office visits, typically
That's right,
specialist
small
visits.
business generally has less than
Um,
50 employees.
But then if you're utilizing,
Yeah, small
say
businesses,
if you're
depending on the size,
hospitalized,
fewer
then
than
you'd be faced
25
with
employees, they
uh,
can access
paying
a tax
the
credit for the
deductible,
shop.
and then beyond that, it'll be
Um,
subject to the co-insurance. So you see a much richer plan in the gold of a $650 deductible and a lower amount of co-insurance, up to a lower total out-of-pocket of just $2,500. Does that help?
So how does the 60, 70, 80 bronze, silver, gold number sort of fit into all of that?
So it assumes a certain utilization of an array of services. And of course, no one is that average, but we would look at all right, what it would be the average. And this is looking at the average person. If they were to utilize that, then 60% of the total plan, or the cost of that care would be borne by the plan, and 40% by the member. That's in the bronze level. And then 70% with silver and 80% for gold. So so in a sense, that one out of every $5
Yeah, and so,
utilization is
I
borne
wish I
by
could show
the
it to you,
member
but
at the
I'll
gold level
project
plan.
here.
Whereas 2 out of every
You go
$5
just to our main page of
is
our
borne by
website.
someone at the
Right
bronze
now,
level.
if you look at, it looks like fine print, but they're very
right,
small
let's get a
print.
couple
There are
others
various
and then
links at the bottom, and
make
one
sure
of
we
them
have
is our
time to get back
actual
to you.
formulary.
Yes.
That's where it's living right now, and as we do updates,
I have a question about
it's going to come to a different place.
children that
You
are
can
under the age
access
of
our formulary,
26,
what the tiering
and
structure is,
thinking
what
that
the
if
actual,
they're under the age of
name
26, they
brands
can
of
be
the drugs
covered.
are.
But my
Tonight,
son lives in
if you have
Colorado,
access to the internet when you get
and
home.
I didn't know, I know that under the current plan that I have, he's not covered because he doesn't live in New England. So I just wondered how that works.
So when you
with Maine
take a look at
Community
that and you
Health
have
Options.
questions, feel free to get
a
right back
great
with us, and
question.
we'll talk about,
I'm looking
what if your
to
drugs
Beth
are on the formulary the way you
and
want.
Rob. Do you have an answer for that?
Yeah, so I'm gonna go out on a big limb here and think that we would be able to cover him, even though he's not in a contiguous state, so. But what I would like to do is, whoever asked the question, I'm gonna give you my business card and I'm gonna follow up with you.
And we do have a wraparound network.
Great.
So if this is like a college student, okay, so you go to Florida.
He's out of college. He's graduated from college. I do have a college student who lives in Colorado as well.
So let's take your college student in Colorado, and they're they're not gonna be able to use the local doctors, but we do have a wraparound network through First Health, and you get a chance to go and look and locate a provider in Colorado near them, and so if they were going regularly to the doctor there, they could be covered by, but we'd have to show that it was an in-network First Health provider in order to get the in-network cost that we're talking about.
And is that just for college students?
No, it'd be for any member. That's what Rob's gonna
Yeah,
double check.
so by allowing that coverage to be extended to family members up to the age of 26, it's not considered a college plan per se. It's considered full coverage for that individual that you would be purchasing on behalf of your son. So it's exactly the same plan that you would choose here, the metallic level. What Beth was trying to describe was the rules of the road are still the same. You need to seek in-network care when you're in the different state.
Thank you.
Just one other thing regarding deductibles and coinsurance. One of the things that, just a shameless plug for our website, as you go on our website, there's a lot of terminology that you can hover over: deductibles, coinsurance, out-of-pocket maximums, and those types of things. So as you look through and want to look at our plans, it is a good opportunity to kind of pick up the terminology and make determinations about how you utilize your health care.
Oh, I have a question that just kind of tags along with this one here. You were saying that if you are traveling to Florida, you have a son in Colorado, there's a national network. Is that the First Ascent? Did I
First
hear
Health.
that?
So we've.
I'm sorry, what's it called? First. So
First
that is
Health.
the national.
We've
so,
contracted with First Health
Okay.
to provide us that national network.
So if we spend time in another state, before deciding on this, we need to find out if our providers are preferred providers on or contracted with First Health. That's the national network that we're asking if they're providers.
Right, so, I mean, you can certainly look up providers in other states and determine whether they're part of the First Health network
Okay.
that we have.
Okay.
We do encourage people to have their PCP selection here in Maine.
Mhm.
That's certainly our preference. We want to make sure that people have that connection to a medical home.
Okay, and one other quick question. Is York Hospital only, and you may not know this, but someone that
And I should
represents York
say,
Hospital.
given that we're where we are, I say in Maine, we're also, as part of our network, proprietary network, we are including New Hampshire, many New Hampshire providers, hospitals, community health centers. So there's a lot of, obviously down in this area, the border is right next door. So we were aware of that, and it actually goes all the way up the corridor, up to, the other side of Bethel.
Okay. And is York Hospital you can only choose this plan, you can't choose the other? There's 2 plans for the state of Maine, right? And this is the only one that York Hospital and its affiliates are going to be participating in, is that correct? I got that information at the Kittery Family Practice the
Right,
other
so
day.
if Anthem chose to exclude a number of hospitals, including York, from its narrow network, so for people that are looking at qualified health plans on the marketplace, on the exchange, individual or small group, if you want to have York Hospital included in network, Maine Community Health Options is your choice.
The only choice.
Yes,
And any doctor affiliated with York Hospital?
yes.
Okay, thank you.
I just have a quick question about emergency care. If you're away, wherever in the country, and you have an emergency situation, do you have to go to a provider that is part of your program, or can you just go to your nearest hospital?
No, we want you to get the care you need on an emergent basis. I mean, that's part of your benefit.
Okay, so that would be a different situation?
Yes.
Okay, thank you.
I was very glad to hear that you're going over into New Hampshire, because a lot of us are on the border and have specialists or PCPs in Portsmouth as well as in York. How can I find that list? I've been on the website. I can't figure out how to even, I guess I address this to you, figure out who the providers are in York or in Portsmouth.
Yeah, so we'll assist you, and so I'm probably going to be handing a lot of business cards out
Okay.
tonight. I will say that so this is a little shameless plug on how we did this in 18 months. We effectively started this just recently, and we have stood up an insurance company with 50 employees in Lewiston in about 18 months. Our website is still being perfected, so our provider search function is going to continually getting better and more granular over time, but right now it's pretty basic. And so if you're not finding what you need, we just want you to give us a call.
Great.
We'll search our underpinning providers for you. We'll search the First Health Network for you, and we will tell you what you need to know. So,
Great.
yeah.
I had a question. I wasn't here at the beginning, and I'm not sure if you covered that. If I needed to go see a specialist in Boston, so you see your primary care doctor first for a referral there, and is that covered in the plan?
So there's no referral required for specialists in network. So that's one. So the question is whether that specialist would be in network or not. But we do foresee the likelihood of referrals heading to Boston, especially for certain types of care. So it's going to be a case-by-case basis there in terms of whether it's in network or out of network and how that's treated. But I don't know if there's anything.
Do you have network in Boston, or is that part of that
Be part of the First Health.
First Health?
Yeah. And as we grow, that we'll be able to build upon that further.